Hello everyone, welcome to this video on the anatomy of the pelvic floor, perineum and some other bits too. I've made videos on the other parts of the abdomen and the pelvic region which you might find useful to watch if you haven't already. You can find the series in order in a playlist that I've linked down below. I'm using my notes based on my university's anatomy guide and some pictures taken online as well. And as always, feel free to ask if you have any questions or if you want links to resources or anything you've seen in this video. Now, just to warn you, because I think YouTube's terms and conditions must state this somewhere, this video does contain anatomical images of genitalia, but that's what we're here for, isn't it? So, let's revise the pelvis first. So there's two different types of things that we refer to when we say the pelvis, and there's a bony pelvis and the true pelvis. The bony pelvis is just all these bones, so the ilium, ischium, pubic bone, the sacrum, and all of those bones together, whereas the true pelvis is actually just this space, so the pelvic inlet and everything inside it. So you need to make that distinction clear. And okay, so first let's go through some parts of the pelvis. So the bony pelvis is made of two hip or innominate bones, and these are the parts of the bone. So looking from the medial view, from inside to outside, we can see the iliac fossa, where muscle iliacus attaches on the anterior 2/3 of the iliac fossa. And then we have the various crests on these innominate bones. So you have the anterior crest and the posterior crest. The most superior crest is the iliac crest. And then we have the anterior superior iliac spine, the ASIS up here. We have the anterior inferior iliac spine down here. So you have these anterior spines and posterior spines as well. So you have the posterior superior iliac spines, the posterior inferior iliac spines. This is from the lateral view, so looking from the outside to the inside. Then we have the ischial spines as well. Now on the lateral view we have the acetabulum, which is the site of articulation with the head of the femur. Yeah, so where the leg comes in, well, I should say the thigh, and the obturator foramen, where several structures, including the obturator nerve, go through. Then we have these ischial tuberosities on the bottom. That's the bony part that you can feel when you sit down. That's the part that you sit on. And this symphyseal surface is where these two innominate bones articulate at the pubic symphysis. And this is another view of the obturator foramen. You have these notches, so this is the greater sciatic notch here, number 8. And then the lesser sciatic notch here, just below the greater sciatic notch. And then we have the articular surface for the sacroiliac joint, which is here, where the sacrum articulates with the ilium bone. So here's another view of the pelvis. We have the ilium, the ischium down here, this bone, and the pubis bone. So those parts make up the innominate bones. And then we have the sacrum, the coccyx. Those bones all make up the bony pelvis. These bones are 3 separate bones, so of the innominate bones, and they fuse around the 16th year of life. The sacrum is made from 5 fused sacral vertebrae, and the coccyx is made from 3 to 4 fused vertebrae, which can be different in different people. So as I said, the greater pelvis, or the false pelvis, includes everything outside, whereas the lesser true pelvis is inside, and the bony pelvis is the greater pelvis. We've got the sacrum, the coccyx, and the hip bones, those 3 things that make up the bony pelvis. The pelvic walls are formed by 2 muscles in their fasciae, so the lateral walls are formed by the obturator internus muscle and the piriformis muscle, which we will have a look at later. And this pelvic floor is formed by other muscles. We'll get onto the muscles later. So here are the muscles of the lateral pelvic wall. This firstly is piriformis, so show you a clearer picture here. So it starts from the back actually and extends from these sacral vertebrae to join onto the greater trochanter. So You can see here it arises from the middle 3 pieces of sacrum and the adjoining lateral mass, and extends medially between the anterior sacral foramina. Leaves the pelvis by passing through the greater sciatic foramen, this greater sciatic foramen here, and it inserts into the upper part of the greater trochanter. That's piriformis. Now, obturator internus, it arises from the membrane and the bony parts of the obturator foramen. So you can see the obturator internus muscle here arises from the obturator foramen, and there would be a membrane covering this foramen in life. So that's where it arises from. The tendon of the internus, as you can see this sharp turn here, makes a sharp turn to pass through the lesser sciatic foramen where a bursa lies between tendon and bone. So you can see this tendon making a sharp turn to pass through the lesser sciatic foramen where a bursa lies. The pelvic floor, or the pelvic diaphragm, is made of 2 muscles, so levator ani muscles, which can be further split up, and the coccygeus muscle. So this is the levator ani group of muscles, and these are coccygeus. Let's break down the levator ani muscles. They're a sheet of muscles arising from the pubic bone, and the obturator internus fascia. They insert into the coccyx the anococcygeal raphe, which is just a line down here, between the anorectal junction and the coccyx. The perineal body here, this little cross here, and the fibrous body between the anal canal and the prostate or vagina. So we've got 3 muscles here which make up levator ani muscle. This is puborectalis, pubococcygeus, and iliococcygeus. So puborectalis in orange, pubococcygeus brown, and iliococcygeus, this grey big sheet of muscle here. So puborectalis arises from the posterior surface of the pubis here on both sides and forms a sling at the anorectal junction. So this is an important muscle for maintaining rectal continence, fecal continence, and pubococcygeus also arises from the anterior part of the posterior surface of the pubic bone, and then it inserts into the anococcygeal raphe here. Anococcygeal raphe, this midline. The iliococcygeus arises from a white line called the arcus tendineus on the obturator internus fascia and the ischium. So iliococcygeus arises from obturator internus fascia and the ischium, not the ilium. Now, I don't know why it's called iliococcygeus, but it does arise from the ischium and not ilium bone. It inserts into the anococcygeal raphe here. So you can see another picture here. So these muscles arising from the pubis bone and the obturator internus fascia, as well as the white line, the arcus tendineus, and then going into the rectum and the anococcygeal raphe. It's this group of muscles here. Coccygeus is the second muscle that makes up the pelvic floor, and it arises from the ischial spines. So you can see it arises from the ischial spines here on both sides and inserts into the lower part of the sacrum and coccyx. The fibers are parallel to the sacrospinous ligament, and the muscles anterior to the ligament. It's innervated by branches of S3 and S4, spinal nerves and pudendal nerves. So this is the pudendal nerve coming from S3 and S4. Should mention the anococcygeal and perineal bodies, which we've had a look at before, but just to make it clear, the perineal body is the little body between the vagina or penis and the rectum. So it's this bit here. We're looking at the perineum from downwards, from inferiorly upwards, and then the anococcygeal raphe, as we mentioned, is this line where all the levator ani muscles insert into down here. And the midline raphe of the levator ani is thickened to form this anococcygeal raphe, and the pelvic body has the function of supporting the pelvic viscera. We look at the perineum now. So this is a female perineum, and this is a male perineum. So the perineum is the part of the pelvic outlet lying caudal to the pelvic floor. So it's the part lying below the pelvic floor muscles, so levator ani and coccygeus. And the pelvic outlet basically means, so we had a pelvic inlet formed from that little bowl shape which formed the true pelvis. Now we have the pelvic outlet, which is coming out the other side. So it's the bottom of the pelvis basically, and it's formed from these structures which we'll get to. So yeah, so this is the levator ani muscles, normal pelvic floor muscles, and then the perineum is a bit underneath, which all these structures have to come out of. So the bounds of the perineum: anteriorly we have the pubic symphysis, laterally we have the ischial tuberosities, and posteriorly we have the coccyx. There's a transverse line between the tuberosities, this transverse line which divides the perineum up into the posterior. So, something's wrong with my mouse. Oops. So this transverse line here which divides this pelvic outlet into the posterior anal triangle and the anterior urogenital triangle. The structures in the posterior anal triangle include the anal canal, the ischioanal fossa, and their contents. We'll have a look at these fossa later. It's bounded laterally by these sacrotuberous ligaments here, and covered by the lower border of the gluteus maximus muscle. The base of the anal triangle is a line joining the anterior parts of the ischial tuberosities. And that's the base. The anal triangle is, the apex of the anal triangle is the tip of the coccyx. So you can see the tip of the coccyx here, apex of the anal triangle. Anterior urogenital triangle, we can see here, or here. And in the female, they pass through the urethra, and the vagina pass through the urogenital hiatus. So we have these levator hiatuses here, and the urogenital hiatus is this one. So in the female, the urethra and the vagina pass through them, and the urethra and other things would pass through in the male too. Posteriorly, the anal canal passes through this rectal hiatus, and the two spaces between the musculature of the levator ani are collectively known as the levator hiatus. Let's have a look at the spaces of the perineum. So this perineum is not just a flat sheet, it can be divided into spaces. The deep perineal pouch, you can see in purple, this deep perineal pouch here. Up here is a space immediately superior to the perineal membrane. And the perineal membrane is this membrane here, which covers some of the muscles inferiorly. And the gap between the muscles and that is the deep perineal pouch. It's bounded above by the inferior surface of levator ani muscles, but there's no distinct fascial layer there. And it contains some structures. It contains the membranous urethra, the external urethral sphincter, the bulbourethral or Cowper's glands in the male, the deep transverse perineal muscle, anterior prolongations of the ischioanal fossae, which we will have a look at, nerves and vessels of the penis in males, and the clitoris in females. The superficial perineal pouches are the space enclosed between the perineal membrane and Colles' fascia, which is an extension of the abdominal fascia. So the space between the perineal membrane and Colles' fascia, the superficial perineal pouches here. superficial perineal pouches. These pouches contain the external genitalia, testes, spermatic cords, penis and clitoris, and 3 muscles which we will also have a look at. So ischiocavernosus, bulbospongiosus, and the superficial transverse perineal muscle, as well as the greater vestibular or Bartholin's glands in the female. We mentioned the perineal membrane, which creates the deep perineal pouch between the levator ani muscles and the membrane itself. It's a thick, fascial, fibrous sheet attached to the pubic arch. It supports the external genitalia attached to the inferior surface, so things like the clitoris in the female and the penis in the male, and it fills the urogenital triangle stretching between these ischiopubic rami here. The apex is missing, so there's a missing bit here, which leaves a gap behind the pubic symphysis. And the membrane's pierced by the urethra, so you can see the urethral opening and the vaginal opening in females, foramina for nerves and vessels, and it's anchored posteriorly to the perineal body in the midline, attached to Colles fascia. Colles fascia is a continuation of Scarpa's fascia, which is the deep fascia of the abdomen. It's a deep fibrous layer running through the subcutaneous tissue of the abdominal wall. So it goes from this abdominal fascia and down into the pelvic region, the penis and whatnot. And it comes back up here as well, so Colles fascia. Anal canal. So the anal canal is the last section of the digestive tract, and it comes from the rectum. So it's a lot smaller than the rectum and should not be confused with the rectum. It forms a right-angled anorectal junction, which should be approximately right-angled at the puborectalis sling of levator ani. So remember we said that the levator ani muscles come around here, and puborectalis was the one that formed a sling around the anal opening. And that creates the anorectal angle. So see how the rectum is here, and then the anal canal goes back like that. This is the anorectal angle, and then it goes to the anocutaneous junction, which is this bit surrounded on all sides by fatty connective tissue. That's important because it allows expansion as fecal matter enters it. On each side, the space is occupied by these ischioanal fossae. So if you have a look here, ischioanal fossa on both sides in green. There's a better picture. Ischioanal fossa on each side of the anal canal. Fossa here. Bounded on each side and all around it by these ischioanal fossa filled with fats. Between the levator ani medially and the pelvic walls laterally, these ischioanal fossa, and they're medially separated by the perineal body, the anal canal, and the anococcygeal body, so medially separated here. So they're bounded by the ischial tuberosities and the anal canal. They're continuous with one another, so they form like a circle. They're not cut off. They're continuous, and they're anterior and posterior to the anal canal as well. Fat within each fossa extends forward between the upper surface of the perineal membrane and the lower surface of the pelvic diaphragm on the lateral sides of the external urethral sphincter. The spaces are the anterior recesses of the fossae. So we have two sphincters, the internal and external anal sphincter, which hold the anal canal closed except for the passage of flatus, so releasing gas, and feces. We have an internal sphincter, internal anal sphincter here, so you can see the anal canal. The internal anal sphincter, which is smooth muscle, so it's not voluntary, it's automatically controlled. It's a thickening of the circular muscle of the rectum, and it surrounds the upper 2/3 of the anal canal. This internal anal sphincter here surrounds the upper 2/3 approximately of the anal canal. Supplied by sympathetic nerves. The external sphincter So this is all external sphincter here. A striated muscle, so it's under voluntary control, somatic control, and it surrounds the lower 2/3 of the anal canal. So you can see the external anal sphincter here. They do overlap by 1/3 of the anal canal, as they both surround 2/3 of it. There's 3 parts to it, so you can see these 3 parts of the external anal sphincter. We have a deep part fused posteriorly with puborectalis, and superficial part lying anteriorly to the perineal body, in front of the perineal body, and a subcutaneous part, the most superficial part, which lies deep to the perianal skin, just beneath the skin. So those are the parts of the sphincters of the anal canal. See on this diagram the deep, superficial and subcutaneous, and they really are split like that. And we have the internal sphincter which overlaps with the external sphincter. And the pectinate or dentate line divides the upper 2/3, so the upper 2/3 here, it should be this line really. Yeah, the upper 2/3 lined with mucous membrane, upper 2/3 of the anal canal, from the lower third lined with skin. Actually, I'm not too sure whether that's, yeah, that should be this bit, right? So this is the lower third and this is the upper 2/3. And that would be the pectinate line then, I guess. Anyway, embryological origins of the anal canal division. It's supposed to reflect the origins of the endoderm and the ectoderm and the difference in blood supply between them. There's superior versus inferior rectal arteries. Then we have innervation, so where they divide. There's automatic and somatic, so endoderm, ectoderm, automatic, somatic. Lymphatic drainage are to different places as well, so internal iliac nodes versus superficial iliac nodes. Now let's have a look at the pudendal vessels, mostly the nerves, internal pudendal vessels and the pudendal nerve, so all the the pudendal artery, vein, nerves, they all run in the fascial tunnel, which is called the pudendal canal, on the lateral wall of each fossa. So there's 2 going down on each side, each fat-filled ischioanal fossa. This is the pudendal canal, which transmits all these vessels. And they give the inferior rectal nerve, the vessels and nerve. So you can see the inferior rectal nerve here. Let's have a look at the vulva, which is the collective term for the female external genitalia. And there's 3 main parts to it. So we have the mons pubis anteriorly, which is a fatty protuberance over the pubic symphysis. The labia majora on the outside, which are hair-bearing folds extending posteriorly from the mons. They extend posteriorly from the mons. And then we have the labia minora, inside the labia majora, which are inner hairless folds united posteriorly at the fourchette. So this is fourchette, and these labia minora are united posteriorly here. The vestibule is a space between the labia minora, so this vestibule, the green area here, and it houses the urethral and vaginal openings, so urethral, vaginal openings. Urethra anteriorly, vagina posteriorly. The vestibular bulb consists of 2 erectile tissue masses, superficial to the perineal membrane on each side of the vaginal opening, and the bulb is covered by muscle, so it's called bulbospongiosus muscle. Posterior to the vestibular bulb are 2 mucus-secreting greater vestibular or Bartholin's glands, which drain anteriorly. So these Bartholin glands secrete mucus posterior to the vestibular bulb, Bartholin's glands. The clitoris is a small mass of erectile tissue. This is the clitoris. You can see on this picture here, clitoris. It's a small mass of erectile tissue which is anterior to the urethral opening. It's attached to the ischiopubic ramus by the ischiocavernosus muscle. So you can see these muscles here, ischiocavernosus, attaches the clitoris to the ischiopubic ramus. It's homologous to the penis and has two corpora cavernosa and small glands, so we will see those in the penis as well. It's a very similar structure. So these are the muscles and the parts. So we have a cross of a clitoris, we have a glans in the clitoris, just like we have a glans in the penis, vestibular bulb, urethral opening posterior to the clitoris, the vagina, the Bartholin's gland, which are mucus secreting glands, and the ischial tuberosities, which bound this pelvic outlet or perineum. You have the anus and the levator ani muscle surrounding it, gluteus maximus on each side, and the anococcygeal raphe. And then we have these muscles, so the ischiocavenosus attaching the clitoris to the rami here, and the bulbospongiosus muscle, which we mentioned before. The perineal body, superficial transverse perineal muscles going across here from the perineal to the ischial tuberosities. External anal sphincter, levator ani muscles, yeah. Seeing a clearer picture of the ischiopubic ramus here. Let's look at the penis, which is homologous to the clitoris, but it's only present in males. It's divided into root, body, and glands, and the root of the penis is attached to the perineal membrane here. Erectile bodies of the penis are supplied by branches of the pelvic plexus, not by the dorsal nerve, as you might expect. So, supplied by the pelvic plexus. The crura of the penis, so this is looking inferiorly, are attached to the ischiopubic rami. And then we can see the two parts, the erectile parts, so the corpus cavernosa and the corpus spongiosum. And there's suspensory ligament from the pubic symphysis. You can see this cartilaginous joint here, the pubic symphysis. And there's a suspensory ligament from this symphysis to the penis, which holds it onto the abdominal or the pelvic region. Now let's look at a cross-section through the body of the penis. This would be somewhere through the midway, so this is front, ventral, dorsal. You have the dorsal veins, so the dorsal vein and the deep dorsal vein, as well as accompanied by the dorsal nerves. We have skin all around it, and the corpora cavernosa, the erectile masses inside it, one on each side, and the superficial fascia surrounding the deep fascia. We have Buck's fascia, which is a continuation of the abdominal fascia. We have these deep arteries inside the corpora cavernosa. You can see the corpora cavernosa here with arteries inside them. And then we have the corpus spongiosum, which has the urethra running through it. So you can see here, 3D version. Corpora cavernosa, and then the corpus spongiosum with the urethra running through it. And this is the glans, so the urethra runs all the way through it to the urethral opening. It's surrounded by Buck's fascia. It's continuous with the septum between the corpora cavernosa and the suspensory ligament. So you can see Buck's fascia, this blue here, surrounding this whole bit. And it's continuous with Colles' fascia. There's two lateral columns of erectile tissue. There's the corpora cavernosa, which are separated by the intervening septum. Sure, you can find a picture of that here. Well, there's just an intervening septum in between here, and they diverge posteriorly to form the crura. So these corpora cavernosa diverge posteriorly to form the crura. The crura are covered by ischiocavernosus muscles. You can see these ischiocavernosus muscles, so where the corpora cavernosa diverge posteriorly, they're covered by these ischiocavernosus muscles. Now the corpus spongiosum, it's all the corpus spongiosum housing the urethra in the middle there. It's ventral. It can engorge, but it's not truly erectile. It doesn't need to be because it's only transmitting the urethra. It commences at the perineal membrane as an enlargement, so a bulb, and then runs forward in a groove on the inferior surface of the corpora cavernosa. So the inferior surface of the corpora cavernosa here runs through there in that groove. And we can see the bulb of the penis here. This is bulbospongiosus muscle surrounding the bulb of the penis, and the glans is an expansion of the corpus spongiosum over the corpus cavernosa. This glans is an expansion of the corpus spongiosum housing the urethra. The external urethral meatus, or opening, is on the tip of the glans. There's prepuce, or foreskin, attached to the glans below the meatus by frenulum, a fold of mucous membrane. So you can see frenulum here, which attaches the prepuce to the glans below the meatus. It's not really pronounced meatus, is it? Meatus, probably. Well, it's just an opening. And let's talk about the urethra now. So it's very different in the male and the female. Obviously, it's longer than the male, and it can vary in length. It can be from 50 to 20 centimeters long. It extends from the internal urethral meatus, or opening, to the external urethral meatus on the tip of the penis glans. So internal urethral meatus from the bladder to the external here, tip of penis glans. The prostatic, okay, so the urethra is split into 3 parts in the male, 3 or 4 parts. We have firstly the prostatic urethra, then we have the membranous urethra, then the bulbous urethra, and the penile urethra. So we have the prostatic, membranous, and penile parts of the urethra. Let's talk about each of those in turn. So the prostatic urethra is the widest part of the male urethra. It passes through this prostate gland, and the prostate gland secretes various substances into the semen. It has an elevation here, so you can see this elevation called the seminal collicus, otherwise known as the verumontanum, on the posterior wall, and ejaculatory ducts open into its summit, while prostatic ducts open into grooves on the side. So we can see a prostatic utricle here, or opening, and openings of ejaculatory ducts onto its summit. Now the next part is the membranous urethra. It's the shortest and most rigid part. So you can see this membranous urethra here, shortest part, most rigid, and between the urogenital diaphragms. It's surrounded by the external urethral sphincter here. It passes through the perineal membrane to become the spongy urethra. So there's various divisions. You can decide how to divide it, but most of us just say that this whole thing is the penile urethra, which runs in the corpus spongiosum to the tip of the glans and the transverse lumen, except at the external urethral meatus, which is the narrowest part of the urethra, where it's vertical, giving a spiral stream of the urine. So this is the narrowest part of the urethra, despite what it looks like. It doesn't look like the narrowest part, but it is. The 2 bulbourethral glands are embedded in the external urethral sphincter. So the membranous urethra is surrounded by the external urethral sphincter, and there are 2 glands embedded in here, the bulbourethral gland and its duct. And they secrete lubricant fluid. Urinary continence, so that's dependent mostly on the external urethral sphincter, which is a sheet of striated muscle, so external urethral sphincter here. External urethral sphincter, and it's not as external as you might think. It's not on the end of the penis, so be careful about that. Internal, which is literally just as the urethra exits the bladder, and then we have the external. External urethral sphincter supplied by the perineal branch of the pudendal nerve, S234. So this S234 also allows rectal continence, so we can say that S234 keeps piss and shit off the floor. I'm not sure where I remember that from, I just remember it from somewhere. So S234 supplies the pudendal nerve, which supplies the external urethral sphincter. The scrotum is a pouch of thin skin ridged skin enclosing the testes, so we can see the scrotum enclosing the testicle here. Each testis is suspended by a spermatic cord. There's a median raphe in the skin of the scrotum and a fibrous midline septum, which separates the scrotum into two cavities. So you can see this midline raphe separating the scrotum into two cavities here. Scrotum is not supplied by one branch only, it's supplied by a lot of different nerves. The anterior third of the scrotum is supplied by a branch of the ilioinguinal nerve, which is a branch of the lumbar plexus, and then the posterior 2/3 of scrotum are supplied by a branch of the pudendal nerve, so S234. The dartos is a layer of smooth muscle in the subcutaneous tissue. You can contract, well, you can't, but it's involuntary, so contraction can result in increased wrinkling of the scrotal skin, but it's involuntary, so you can't control it. Now, the ilioinguinal nerve, we mentioned, anterior scrotal, a labial branches supply the skin at the root of a penis or clitoris and the anterior part of the scrotum. The sacral and coccygeal plexuses. So these are networks of nerves which lie on the posterior lateral wall of the pelvic cavity. They innervate the lower limb and the muscles of the pelvis and the perineum. The sacral plexus is formed from the lumbosacral trunk, which comprise these spinal nerve roots. So, formed from the anterior primary ramus of L5, a branch from L4, and the anterior primary rami of S1 to S4. So L4 to S4 makes up the lumbosacral trunk. The coccygeal plexus is a small plexus down here. It's formed from a branch of S4, which also contributes to the lumbosacral trunk. So it's formed from a branch of S4, the anterior primary ramus of S5, and the coccygeal nerve, which is a tiny nerve down here. So the coccygeal plexus, tiny plexus here. Now we move on to the pudendal nerve, which we see here, S234. And it's formed by branches of the anterior rami of S2 to S4. We're not going to forget that, are we? So, branches include the inferior rectal nerve, the perineal nerve, and the dorsal nerve of the penis and clitoris. So, inferior rectal nerve, perineal nerve, continuing into the scrotal nerve, and the dorsal nerve of the penis. So the inferior rectal nerve, it arises in the posterior part of the pudendal canal, otherwise known as Alcock's canal. So this is a canal which transmits all the pudendal vessels. Arises in the posterior part, inferior rectal nerve in the posterior part, and it passes medially over the roof of the ischioanal fossa. It gives branches to supply the external anal sphincter, the perianal skin, and part of the levator ani muscles. And the perineal nerve, see the perineal nerve here, divides into more branches, so the scrotal or labial branches, the muscular branches, and the nerve to the bulb. So you can see the scrotal nerve here divides into more branches as well. The medial branch of the scrotal or labial branch passes with the scrotal or labial artery to supply the scrotum and labia, unsurprisingly, and the lateral branch supplies the anus. So two branches there. The muscular branches supply the transverse perineal muscles, ischiocavernosus, bulbus spongiosus, external urethral sphincter, external anal sphincter, and levator ani. And the nerve to the bulb supplies the bulb of the corpus spongiosum. Sorry, I had to drink some water. Supplies the bulb of the corpus spongiosum. The dorsal nerve of the penis and clitoris. Dorsal nerve of the penis here would be clitoris in female. Is a branch of pudendal nerve, supplies the skin of the penis and clitoris and the glands, and is a continuation of the pudendal nerve. It runs forward in the ischioanal fossa and pierces the perineal membrane. Then it supplies the perineal muscles and the skin. The perineum is below the pelvic diaphragm, as we saw, and the pudendal nerve must exit the pelvic cavity. It leaves via the greater sciatic foramen below the lower border of piriformis. The piriformis is an important landmark. You have various nerves exiting above and below it. And then it winds over the sacrospinous ligament to pass through the lesser sciatic foramen to enter the perineum. It embeds itself within the obturator fascia in the fascial tunnel, or the pudendal/Alcock's tunnel. So that's it. That's all the anatomy of the pelvic region. If you watch my other video, you'll get a more clearer sense of all the anatomy available to learn there, pretty much. And now let's have a look at some clinical or pathological applications. So we have first this episiotomy, which is the procedure of incising the posterior wall of the vagina and the skin behind it. So we can see childbirth taking place here, the infant's head coming out of the vagina, and we don't want to tear the perineal tissues because this can result in urinary or fecal incontinence after childbirth. It's very unpleasant, so we can incise the posterior wall and allow the baby's head to come out. Vasectomy. Vas deferens can be ligated, so we can cut the vas deferens in the superior part of the scrotum. Sperm production continues, but the sperm can't reach the urethra. That's the procedure. And then we have the pudendal nerve block, which is used on pregnant women before they're about to deliver to reduce the pain of labour. It's a common obstetric procedure to anaesthetise the perineum during delivery, and the root cause of the pain from the second stage of labour results from distension, so stretching of these parts of the lower vagina, the vulva, and the perineum. The pudendal nerve blocks provide analgesia, and they also relax the pelvic floor during forceps delivery, which helps. They can provide anaesthesia of the perineum to create or repair an episiotomy, and it's commonly done via the transvaginal approach. So we can see an image of it here. We insert the finger until you can palpate the ischial tuberosity on the inside of the vagina. So we have a needle, which is pushed through the vaginal mucosa and the sacrospinous ligament to infiltrate the tissue around the pudendal nerve. The position of the internal pudendal artery crossing the tip of the ischial spine renders it safe, and need to withdraw some of the syringe plunger, so we need to suck some out after we plunge it all in. Verify that the artery or vein has not entered, so if there's blood in there, then you know it's not good. Ischioanal abscesses, so these squiggly red lines mark the places where ischioanal abscesses can happen. They're pretty common and need to be drained by incising the skin lateral to the anal canal. The inferior rectal nerve and vessels are identified and protected during the procedure, which are very important. A urethra can rupture, so the junction of the mobile penile urethra with the fixed membranous urethra is a common site for the traumatic urethral rupture, because remember, the membranous urethra is the stiffest part of the urethra. It produces oozing and extravasation of urine into the superficial perineal pouch, so the urine going in there produces the appearance of swimming trunks. The chorus, scarpa, and scarpus fascia are continuous, so that's how the urine can leak into that area. And the female urethra is straight and opens onto the surface immediately after piercing the perineal membrane, so it's not subject to the same trauma as males. Damage can be done to the pelvic parasympathetic nerves, so these splanchnic nerves here supply the parasympathetic innervation to the pelvis. The pelvic splanchnic nerves are known as the nervi erugentes. They carry the preganglionic parasympathetic axons, and upon stimulation they produce erection. In males, the postganglionic fibers descend inferiorly along the posterolateral aspect of the prostate gland, and they're surgically referred to as cavernous nerves. They run next to the prostatic artery and the vein, forming the neurovascular bundle. Below the apex of the prostate, the nerves pass into the lateral aspect of the external urethral sphincter, then onto the membranous urethra, which they follow through the perineal membrane to reach the corpus cavernosa. And as you can imagine, with this distribution, the operations on the rectum and prostate are risky, and these nerves need to be identified and protected. So thank you very much for listening. That's it for this video. If you enjoyed, please leave a like and comment any feedback or questions down below. Subscribe, and I will see you next time.